We have now seeing about 150 new patients a month in the clinic. When we started a year and a half ago, we were seeing about 3 to 5 a week. So that tells you just the increase in demand for this kind of care for people with longer term symptoms of COVID. People are really anxious because they don't understand it and they don't know why they're experiencing the symptoms. So a lot of what we do is education and really helping people to develop strategies that work for them in their lives to help them manage the symptoms. People who have the longer term symptoms of COVID tend to have a variety of different symptoms. So, on average, at least 9 to 10 different symptoms, and it affects different organ systems and can affect people physically, cognitively, and in terms of their mental health. So, it really takes a holistic approach to be able to help care for these patients. There's a variety of different types of symptoms that people experience. The most common things that we're seeing in our patient population are fatigue and really debilitating fatigue. That seems to be the number one issue that people are struggling with. But people are also really struggling with headaches and sleep disturbance and anxiety, as well as a variety of neurologic symptoms and poor endurance and limited ability to exercise and return to activities that they enjoy. When I became sick early in the pandemic, we really didn't have a good understanding of long COVID symptoms. So many of the things that I was experiencing, I was confused about, and there was a fair amount of anxiety about that. When you have symptoms that you don't understand and you don't know why that you're having these new symptoms. Once I was able to really identify some of the most common triggers, which are common triggers for most of my patients, not having enough sleep, being stressed, not eating well, generally feeling run down or overexerting themselves physically or emotionally. Once you're able to identify those triggers, then you can have some control and you can learn to avoid those things and to reduce the things that cause some of the longer term symptoms. We've seen a handful of breakthrough cases of people that have gotten COVID after being vaccinated, but still the vast majority of the people that we're seeing in the clinic are people that were not vaccinated at the time that they got infected with COVID. So that still continues to be the trend that most of the people are unvaccinated that have long COVID. The ones that we have seen tend to improve a little bit faster and tend to have more mild symptoms than people that had COVID when they were unvaccinated.